Morning. Good morning. Thank you all for attending this morning. My name is Harrison Pierce, and I'm the chairman of Health and Human Services Commission. And I will now tell you why I'm stating that. We did a communication from Pam Flynn, who's the executive assistant to the first selectman's office, Kevin Moynihan, about changes in the state. They changed the remote meetings legislation and guidelines. So you all did get a copy of that, I presume, correct?
Yeah.
All right, so I will just read some of it and highlight it. All commission members must have received the Zoom link by now, and it's posted on the website, which is this. I don't know if that'll happen with every meeting or not. Record the meeting to the cloud, which we do. Votes must be taken by roll call unless the vote is unanimous. Members, guests, and the public must state their name and title, which is why I did it, if applicable, before speaking. I think once you've announced your title once, if you have one, then you don't have to do that throughout the meeting. But probably, I think we have to, whenever we speak, do we have to say our name? We'll try it, see how it flies. Meeting minutes must identify which member attended by Zoom and those that attended in person, and follow previous established procedures for filing votes and minutes with the clerk, and have IT post minutes and recordings onto the website. So I think those are the essential parts of the message. That said, we'll move on to our agenda. Approval of the June 3rd, 2021 minutes. Any corrections, questions? If not, may I have a motion to approve?
I so move. Tom.
Your second.
All those in favor?
Aye.
Hey,
Reports. Good morning, Jen. Health Department.
Good morning, Harrison. Jen Eielson, Director of Health, Town of New Canaan, obviously. So I'll do a quick COVID update before we update on everything else. We have one new case this week. Just like last week, we had one new case. In the town alert data, there's 800 tests taken in the last 2 weeks with New Canaan residents for a 0.10% positivity rate. So that's great. Vaccine update, we've administered 13,773 doses through the New Canaan Health Department, which includes 20 we did yesterday. We have 10 more scheduled for tomorrow. So my nurse Amy continues to vaccinate Vine Cottage regularly throughout the week. Some of the numbers in the ages of 12 to 15%, we're at 70.88%, which is the third highest in Connecticut. Ages 16 to 44, we're at 96.29%, which is the highest in Fairfield County and the second highest in Connecticut. Ages 45 to 64, we're at 85.41%. Ages 65 plus, we're at 99.64%. All ages of total population, we're at 74.18%, which is the highest in Fairfield County. And the percentage of population fully vaccinated is 65.57%. And like I just mentioned, we continue to administer all 3 doses at Vine with my nurse Amy, and Shannon does all the scheduling. So we're still motoring along with that. Part of the COVID, I have to do after action reports as part of the public health emergency preparedness grant I have. So some of those numbers that I have in what we did for COVID, for masks, we distributed to 443 residents that we personally delivered masks to seniors along with the help from the fire department. We provided masks to 57 food establishments, 109 local businesses, 1,239 condo complexes, units, and over 2,600 cars at Waveney Park. Testing, we did over 10,255 tests that the health department was responsible for all the registration and results of. That includes Dr. Murphy, the Stanford Hospital, docs, and then the Waveney. It doesn't include physician one or any of these, you go somewhere else. This is, which is what the health department was responsible for. The food for seniors that I did in coordination with Dr. Lutzy with New Canaan Public Schools. Thanks to him and his budget for that, we provided groceries 4 times every 2 weeks to 56 seniors. For sector rules inspections, that was mostly Chris. That was all, those little guidelines they had to do. We did 261 inspections of that. Cases, we did contact tracing of over 1,400 confirmed cases. So that was the COVID for what we have. For our real life of our other work, we just finished out the fiscal year yesterday. All our revenue items are way over, especially with the septic and the building permits. So we did all the 49 truck inspections I did in June. Those are all paid and inspected. Chris just finished all the salons, inspecting and relicensing them. We only have one outstanding, which I'm going to serve an order to today to close for not submitting and paying their fees. The only line item that we were under for revenue was restaurants, because there wasn't many outdoor temporary events held at Waveney Park. So we were under on that. All the pools have also been inspected and relicensed. There's only 2 pools that we haven't done yet. They have paid, we haven't done, because they're still working with their condo boards and what the rules are going to be for that. The ELC grant I submitted, which funds my public health nurse, I submitted the financial report and the progress report of the budget period 1 that we already had the money and paid for, and that was done. I submitted budget period 2 of the actual grant application, went through several revisions. It was approved, but then yesterday on the state call, the state kind of dropped a bombshell that they're not really sure where they stand with budget period 2 of the ELC grant. So I'm not really sure how I'm going to pay for my public health nurse going forward. So needless to say, I didn't sleep well last night. So hopefully the town can do something, if I have to go back before the Board of Finance or what, but the state will let us know in the next 2 weeks. So, I mean, obviously I can't lose my public health nurse. So there's going to have to be a solution to that, especially as we continue to vaccinate, and we want to expand programming, especially like reviving telehealth. I've been talking to Russ Barksdale about, Jim Lisher will be talking about, and, with the potential another wave coming in the fall with the, Delta variant, because, those, even though we have very high vaccination rates, you still have the unvaccinated, that the under 12 group that can't get vaccinated yet. And there's no timetable on that until sometime in the fall is all we kept hearing for the under 12. And Moderna, there's still no approval yet on their 12 to 17 age group. That's still pending. So we'll see. And that's it.
Thank you, Jen, for the
I have a
update.
question, Jen.
Mm-hmm.
Lisher member. Trucks. What do we, I didn't know we inspected trucks. Do you said at the
Oh,
Merit?
the garbage trucks and
123?
the garbage trucks and the septic trucks.
Ah, gotcha.
We do it down, it's an ordinance. We do it down at the transfer station. And then it's actually, if you don't have one of those licensed trucks and you use them for your garbage pickup, you have to pay a different fee with the transfer station. So
Ah,
it's becoming really involved now. So Bob Mantilla over at Town Hall has been tracking all that with the transfer station and making sure that, the fees are correct for the residents and they're getting the licensed truck.
yeah. So you're not checking commercial trucks delivering?
No, only septic and garbage trucks.
Okay, thank you.
Fun
Jen,
times.
I have
I
a
have a
question.
master's degree to do that.
Other duties does assigned. Okay, thanks.
Jen, I have a question. What is the
Who
per,
are you?
oh, sorry, Alicia Meyer, Commissioner. What is the per quarter cost of the public health nurse? And if
The
the state decides not to fund it, how can we best advocate or
So-
help get the funding?
Thank you for asking. So the grant that we were, first of all, supposedly guaranteed, we have the letter saying that's why all the directors of health are pretty angry right now. What the funding they were supposed to pay me for, what's in the budget, the $51,215. So, I mean, you're not talking millions of dollars here, but you know, going back through the process and hoping the town agrees with me that I need it will be, you know, crucial. It's not something I wanted to deal with. I'm hoping the state just gives me the money like they're supposed to. They receive, you know, hundreds of millions of dollars from the federal government, supposed to go to public health. It doesn't seem to be making it to public health though,
Well,
which is really sad.
the state is running a budget surplus right now also, so I can't understand why they would be carving off stuff like that that's important.
I'm beyond angry. They just passed, you know, Lamont's budget, and our directors of health were advocating that every local health department be funded with per capita funding. Because the towns under 50,000 residents have received zero per capita funding for over a decade. So you'd think after what we just went through with the pandemic, that, you know, the legislature and powers that be would have started funding everyone. Nope. They passed the budget. Still, everybody under 50,000 gets nothing. So Darien, New Canaan, Wilton, Monroe, half of our, you know, our health departments in Region 1 received zero from the state in per capita funding. It's just despicable to me of why local public health is continually not funded properly at the federal and state level. This is why this happens. I don't get it.
I don't either. I think,
Yeah, this is Tom, Commissioner. When does this become an issue? Right now, it's a threat, but when do we actually run out of money that we'd have to take action one way or another if we wanted to keep the nurse?
Well, it's already kind of an issue because, you know, it started at the end of May. That money, I still had money left over from budget period 1, luckily. So she's still, you know, being funded. I don't know how much longer I can keep her without. I don't know if the COVID accounts are still, you know, open after July 1, if I can still just put it under COVID. I have no idea. I mean, that's something, you know, maybe the Board of Finance or someone can clarify on how this works.
just in addition to talking about vaccinations, et cetera, you're probably all aware of this, but with the mRNA, all the long-term effects seem to be great. And, so we don't know about booster with exception of certain age groups and predisposing conditions, et cetera. And these vaccines seem to be working well in combination too. So the Pfizer and J&J or the Moderna and AstraZeneca, what have you. And that's great. And to date, even though Delta is a concern worldwide and becoming more so, the vaccine seems to be effective in protecting against it, at least preventing serious disease requiring hospitalization, et cetera. The census, the COVID census in the local hospitals is ranging from about 0 to a few. And all those that are going in are those who have not been vaccinated. So FYI. Next on the agenda, Human Services Department, Bethany.
Hi, Bethany Zaro, Director of Human Services. We went through our quarterly numbers for the end of this quarter, and we're really back to pre-COVID numbers in terms of food pantry, phone calls, things like that. There is a return to normalcy. Business is still booming. Jackie and Marcy will both explain the number of, increase in referrals we're having. New Canaan EMS, we're working with them in terms of offering AED and CPR hands-only training for employees. We will be having our first one July 15th from 11 to 12. And then there's going to be other dates. Some of the directors wanted to break out in groups, like for DPW, things like that. Health fair for employees is scheduled for Wednesday, October 27th. It will be in conjunction with the flu clinic. So we're working with insurance agency, things like that, that we do every year. And it's going to be really fun this year at Waveney. And we just want to make sure that the directors and everybody give the employees time, not just during their lunch, but to go to the health fair, get a flu shot, and see all the wellness ideas and measurements that we're going to be giving with them, and lots of freebies. Salvation Army, the back to school program, $25 gift certificates this year to Kohl's. Originally, historically, it's been $40 gift cards. So they're, funds are low for them, but we will be offering the back to school program with a backpack, the usual school supplies, and we have received an abundance of food gift cards. So to offset the $25 Kohl's card, we're going to give a number of food establishment gift cards in this area, which the clients love. Farmers market vouchers, we've distributed the first round that goes until the end of July, about $5,500 worth of vouchers for the food pantry clients. And we'll see how much is generated for the vendors. At the end of July, they will start turning in their invoices and vouchers so we can see. But we've had 2 distributions last year, and that was very successful, with a few $1,000s going to each distribution, like $8,000 in vendor money. So that was great. And then Taste of the Town. I've been working with Laura at Chamber of Commerce. And again, the food pantry will be the recipient. She asked if we could have more of a presence, Human Services. Absolutely. So I will be there. One of the real estate agencies is going to be sponsoring it. And she's just, hoping that the town entities, the stores will be wanting to participate as well. So that's August 25th. And then the flu clinics, I've signed up. We have 2 at Lapham, waiting to hear from the men's club. And I'm doing my usual 330 doses. That is where we're at. We've having the COVID, the silver lining. We have so many people calling now for referrals across the age span. So that is fantastic. Our department really was successful with Jackie and Enza and Marcy working with the community. So very pleased. We now are on a roll to get back to normal and start going into programs and other hands-on to help those in need. So that being said, that's my quick report.
Thank you, Bethany. Adult and Senior Services, Marcy.
Good morning, Marcy Rand, the Adult and Senior Services Coordinator. I have begun working on renter's rebate. So far to date, we've done 10 applications with approximately a $1,900 funding, and that will continue for the next few months. I've been working with Senior Protective Services as well, with a few vulnerable residents here in town, and we have worked really well with the New Canaan Police Department on that as well. They've been fantastic at calling us when they have a concern about a resident, as well as one in particular, sort of resistant adult child. On one of our home visits, they came along with us, and that was very helpful. It's been great to work with them. We continue to do outreach calls and make referrals throughout this month. I am planning some programs at Lapham. We are going to focus on mental health and support. We're going to try to make a weekly visit group with that. I attended a very fun kickoff to summer party at Lapham, and it was nice to see all the seniors with no masks and smiling. It was great for an in-person event. And I am also, Nuvance in Western Connecticut Health has started running a weekly senior community care team rounds meeting over at Kingsway Senior Housing in Norwalk. I will be attending that weekly as well. It's a fantastic program. They will be discussing new programs for seniors, along with client issues that everyone in Fairfield County is having, new programs for seniors, referrals for seniors. They're going to be discussing ethical issues and housing options, et cetera. So that's going to be a fantastic resource for us, as well as like networking and getting to know other organizations outside of New Canaan. So that is what I've been up to.
Thank you, Marcy. Sounds interesting with new events.
Yeah.
Jackie, Youth and Family Services.
Jackie DeLuey, Youth and Family Services Coordinator. I wanted to say that, I wanted to give a shout out to the rec department. They have been wonderful. They do all of our reduced pool referrals and reduced camp referrals, and things come up for families. I've had a family that had a health emergency for somebody in their family, and then they needed their money back. So Steve Banco and his team have been just so wonderful about agreeing to give these people money back, because that's hard-earned money that they need, and if their kid can't attend the program, but technically that's not their probably their policy. Even a few families that if they live in a condo, we wouldn't have known about them, but they can't afford to pay for the full pool pass, but because their condo isn't opening a pool. But then there's been a few that the condo decides they're going to open, July 1, and then they've also been able to get their money back. So just so wonderful working with them. It is kind of a tricky thing sometimes to help people figure out camp options and all of that stuff. They need full days. The Y fills up very quickly with their camps. Also had great experience working with the Booster Club. They were able to give a family of ours a camp discount, and then we had to chip in a little bit, but it was just great because they were a new one for me, but I really was trying to think outside the box for this student. Also, I think I'd mentioned, because I had a site visit at a preschool early June, but I've scheduled some for the fall. So they're happy to have me come back, see their kids and their staff. So that's great that, I'm welcome back and can do that. Much easier to do that in person. I'll run through a few things that I've seen over the month of June. Preschools contacted me on referrals for psychologists, some for potty training for families. I've gotten involved with the police for a report. Someone was suicidal and there were substance abuse issues for a parent. So just providing them with the right referrals for that. There were actually 4 DV reports. I had provided an extensive list for contacts for young adults needing treatment. I referred a teen to Kids in Crisis, so they're staying at Kids in Crisis now. And what they'll do is they'll work with the family to kind of smooth things out and get that child back at home. That's the hope anyway. The YMCA contacted me. They have a job in their childcare. They've started their childcare room again. So that means a parent could bring their child during the time that they work out. So that's great because that hadn't been operating. So I've referred several responsible people that might be a good fit for that. I think they needed 2 people, and that runs I think it's 9 to 1 or 8 to 1 every day. And then we'll pick up also on the weekend. We also had a client that might be a good fit for that. Bethany had connected with a director at Catholic Charities, which they have a lot of these great financial programs, they can help people with a loan or maybe emergency financial assistance grant. So I've actually given them 3 referrals, and 2 were for rent assistance, and 1 was actually for a car. So, that's amazing that they were able to find a car for a family so they could get out of a high lease. And the car was I think donated to them, or maybe there's a smaller amount that they have to pay. So I love working with them because it also offsets what we have to provide, or sometimes a family needs a lot more than we can provide. So if a few of us come in on it together, it's great working with them. And a lot of these agencies like to know if we're assisting, they'd be more willing to assist. Helped East School social worker with some needs for camps this summer. She was new, so she wasn't aware of what the camp options were. Also SACS guidance. We had a family that needed some creative summer activities, and Live Girl, if anyone's not looked at their offerings, amazing stuff, social justice stuff, empowerment. Great programs for girls. pretty much like, I want to say that older elementary age to like teens, amazing programs, and they offer scholarships as well. I actually was working with the e-school principal and the secretary on a summer plan for a family that we know of. A lot of referrals for like housing and eviction provisions, and that's some of the people I mentioned. I think Catholic Charities can help, but also the organization that we work with for fuel assistance also helps with that. So they're wonderful and responsive and have helped a lot of our families with that Unite funding for rent. That has not been easy. And some people have applications from March and they've seen no funding go to their landlords. So hopefully that can get paid in the future. If anyone's not familiar, there's a program at family centers called the RIGHT program, and it stands for Reaching Independence Through Employment. So I've had 3 referrals to them, and they work with people on resume writing, possible job referrals, you know, and a lot of other like skills that people don't realize, especially if they've been out of the interview game. You know, they can get like, because you want to, they don't realize you have to update your resume for the particular job that you're looking for. And actually, when I was giving Bethany numbers for clients and families, I think there's been like, I have now 5 new families that we're waiting on financial assessments from. So that will add to those numbers. I'm sure July we'll see a jump there in families. And then I was working with the police department. They referred a family on a teen that was vaping, you know, and just trying to educate families that vaping marijuana, it can be an addiction. You know, I think people think, and especially today now being July 1st, we'll probably see, you know, marijuana use go up tremendously, but just continuing on that education. Paul Reinhardt has been a champion in this area, you know, having people understand that vaping, nicotine, vaping, marijuana, these are addictions and they're serious and we don't know what's in these devices. So it's very scary. And if there's any questions, I think that goes through my list sort of there for June. Let me know.
Jackie, a question, how was the suicide attempt gesture, whatever, handled? Privately or through?
Privately, yes. And actually it was like they were already headed to treatment. So it was just sort of, that was like in the works. So the person is where they need to be, but we just had heard about it because Bethany has mentioned that the police department, their team is now called, excuse me, it was COAST, and now has a better, easier acronym. I think it's like, I'm forgetting, but they forward us all these kind of tricky reports to get our sort of input. Marcy and I get probably several, you know, every few weeks. And it's good for us to give them input. The police will follow up. We can follow up directly. It's good to have multiple calls because they might not feel comfortable calling me because now I didn't come out to the scene and they don't know me. But if the police follows up again, they feel comfortable talking to them because they met that great officer that came out to the scene. So it's good for us to have, and that's what we've been doing with domestic violence reports for the last like 16 years, actually more. It was before I started, you know, following up, having the town follow up, the police, because you know, that, or if they're not comfortable talking to us at that time, we'll hear back from them, which is great when they're ready, you know, to get that referral or to be in that frame of mind to kind of work on that help.
Great.
Thank you, Jackie.
Can I say something?
Yes, please do.
Minor commissioner, to follow up on what Jackie was saying, is our next meeting, as you know, is Thursday, the 2nd of September. But the vigil is taking place Wednesday night, the 1st. So I'm hopeful to see everyone there for the 5th annual alcohol and drug awareness, especially since we're now a dope state with the marijuana. So we're going to have a lot of people that are going to be in trouble. So hope to see everyone at the vigil. Thank you.
Thank you. Great idea.
Thank you, Lance. Old business,
I have a,
nothing on the agenda. Jim, you want to say something?
well, I thought you were starting with new business. I'm sorry.
Okay.
I have 2 announcements in new business.
New business, Kids in Crisis at Saks. Bethany, you want to address that?
Yes, so I contacted Kids in Crisis in regards to the budget with increasing our grant for a Kids in Crisis Teen Talk counselor at the high school. I would like to pursue having a counselor at the middle school. So on July 15th, Harrison and I have a Zoom meeting with 3 of the director and 2 other people at Kids in Crisis. I just want to get a feel. One other town has a middle school teen talk counselor. So we're going to get information. We're in a gathering exploration period with this, but I really am hoping, the goal is to get a teen talk counselor in the middle school for the following year. And I don't know cost wise, things like that. We will get details later, but I just wanted to know, if there was the commission's support on this to go ahead and, aggressively make this happen, because I would like to see it. I didn't know.
Bethany, this is Tom. Could you just elaborate the rationale for adding it to the middle school as well as the high school?
Yeah, it's early intervention. It is kids in the middle school, the 7th and 8th graders, they are in finding that they do have the same issues leading into high school. It doesn't just crises don't start just as a freshman in high school. So it's educating and having the kids understand that there is this teen talk counselor. Jackie, do you want to go in more into?
Yeah,
Because
so
you're in touch with them.
Tom, what it could help with is like the social workers and the guidance counselors that are already there have a caseload already. So they start the year with kids on their caseload, and then kids get added obviously with IEPs and 504s. And what happens is they don't have any extra time. Like if a kid comes in a divorce situation, actually I'm hearing a ton of that age, that middle school age boys, feel like they have no friends. And I don't think this is a product of COVID. I think social, media and phones and gaming, all of this stuff adds to that, because kids are doing that more and they're not in person with kids. So that person could run groups. I mean, maybe they could help with grief stuff. They could help with the self-esteem, conflict resolution, empowerment, so that person, and they don't work for the school. So parents in this community actually like to know that better because they are paranoid that things are going to end up on a school record. So it's better sometimes. They don't want kids to go to school and tell them what's going on, with the family. So this is a safe way to kind of have that person, they could do counseling with a child, and it's great because it's during the school day, or if it's during lunch when they feel like they have no one to sit with. Like Ed Milton used to run a lunch group when he worked at the high school because kids had nowhere to sit and they felt so ostracized in the lunchroom. So, I mean, there's so many ways that they can add to that. And I think when parents call me from the middle school, I could now say, well, this person could do a check-in with your child at middle school that's having peer issues or whatever it is, and they can pull them out of class, with the parents' permission. So there's so many things that can be done. It would be wonderful to see if we can get that, because if anyone, Jim might hear the original, on this group, there was one, I think before my time, it might've been part-time at Saks. And then I don't know if it went away because the person left Kids in Crisis and then they didn't fill it. I don't remember.
Does the people at Saks, the administrators and counselors, and do they advocate for this? And are they asking that we do it? Because they're there day to day, and I have the impression that a lot of the people who work in those areas have sort of booked up schedules with appointments.
Yes.
So when somebody comes in on Tuesday morning with a crisis, that they're already booked with other things. So the person we'd be talking about bringing on would be not only independent, but also have the time to react to sudden crises rather than everything scheduled out days and weeks in advance. So, but are we getting input from the school leaders and professionals that this would be a very valuable thing to do?
I think they thrilled, Bethany. I mean, you probably haven't. I think it's good to know what it's going to cost and what before but I know that Principal Gusich would be thrilled, and his team. I mean, all of them would be, because again, like you said, they have to be pulled off whatever they're doing if there is a crisis, but to have that other person on that team to kind of coordinate things and be in the know. You know, the nurses deal with a lot. I speak with them sort of on a regular basis, actually more of the nurses at Saks I happen to than high school. But yeah, I mean, I think this would be probably a gift for them if we could make this happen. So I think, you know, bringing them in on the conversation once we know financially what this would cost, I think they'd love it. And Tom, the person trained to work with that, they'd be a social worker or an LPC and be trained to work with that age.
And the thing is, one of my goals would be, in terms of the funding, you know, having to outsource and pull funds together. I know in some of the other towns, the Board of Ed does contribute to a teen talk counselor. You know, it's not just coming from a line item from Human Services, and there's donations, there's things like that. So we can get creative, but I just think these mental health issues, psychosocial issues, I mean, they start not in high school, they start in the middle school.
Absolutely.
To me, prevention, wellness, and knowing the resources and knowing that there's the same resource, maybe somebody different, but is in the high school. And I just think it's great to have this spectrum and this lead in to the high school, and maybe it'll help, prevent a kids in crisis, but also relieve part of the public school counseling situation as well, which is, I know it's just jammed packed.
Yeah,
Have a
along,
comment also, from a standpoint, I worked for a number of years with a national organization whose job it was to build self-esteem with teenagers, particularly minorities, keep them in school. What we found is that whenever we could get our program into the junior high, you have infinitely more impact in the grander scheme of society, because that's where real attitudes and problems begin to emerge. So you certainly have my vote for proceeding forward.
And I'll get
Yeah.
more information. Yeah. This will be old business next month, but I'll keep you up on that.
Great.
yeah, I think along with what Jackie said, the staff at Saks would be very happy to have this person on board. We've discussed intermittently through the year the increased incidence of mental health needs. It's not only 7th and 8th grade at Saks, it's 5th and 6th and before that, but we won't deal with the elementary schools yet. It's social media and it is COVID that played a role at some point in time with these kids over the last year. In 2020, there was a 20% increase of mental health emergency room visits in this age grouping. Just to let you know where we are with that. And there's a shortage of child and adolescent psychiatrists, there's a shortage of hospital beds for behavioral health throughout the state. They're trying to address it, but it doesn't move quickly. I will refer you to the New York Times yesterday, June 30th. There's an article on mental health in this age group, and it's very informative.
Harrison, this sounds like, first, my other reaction as a total amateur in this area is that the right place to have the person is at the school, because that's the hardest part of the day for so many of the kids. And having somebody right there makes all the sense in the world. So what does the commission have to do right now on this potential proposal? Do we have to endorse it or just be ready to act on it should maybe next time? What's our action?
Well, I think it's in the conversation stage, right, Bethany?
Right, we're just in the exploration discovery period in terms of like finances and compatibility, at where someone would go at Saks. There's just a lot of questions that need to be answered. And so that I would like to then approach, with a formulation of what this actually would entail. But before I go ahead, I just want to make sure, there's a blessing on this, because I am, definitely taking time from Kids in Crisis and things like that to educate us on what this all means.
When Bethany and I met with Kids in Crisis a number of months ago, they were certainly in favor of this, and they do have it at a couple of places. I think Ridgefield being one, maybe Westport also.
Yeah.
And we're just, as we've all discussed, we're seeing the need.
Big time. Okay.
Well, I suggest that we, pass some sort of a resolution encouraging Bethany to proceed with studying this and costing it out and looking for potential financing sources. So.
Yeah, I'll get the cost analysis, everything like that, and give you more numbers and more concrete answers as I learn more about this for the SACs. But we're all set, thank goodness, thanks to everybody for the high school.
Great.
Still the same person, right, Jackie? The same social
Oh,
worker?
God, yes, I haven't heard. Yes, I think Grace is continuing. Oh, please.
Okay. Yeah, I'll find out more on the 15th. But I will. I'll report back to you what I find
Great.
at the next meeting in September. So thank you. Thank you for your support. I think it's an important idea.
Thank you. That does lead us to, Jim, you said you wanted to mention something?
Yeah, I have kind of 2 points. One is an announcement. For any of you who know Lucy Bainey, who lives in town for a very long time, we dedicated on Monday with a lot of people from Hartford down and the Fairfield County political hierarchy all there. Lucy Bainey Center for Family Reunification, which is the first of its kind, certainly in Connecticut, if not national, of providing women who've been incarcerated and are now on parole, as it were, into a halfway house in Bridgeport. We have residences for 20. Half of them will have their children, young children, boarding with them. And we have a Head Start program on premise. We have a social worker on premise, and then all of the facilities of Career Resources in helping people get a job and, again, making a readjustment to the community as fast as possible. So if any of you know Lucy, unfortunately had an accident, a bad accident, and broke a bunch of stuff, bone-wise, the day before the opening. So she's, I think, out of the hospital now, but will be recovering for some time. But it's, I think, a terrific thing for not only a resident of New Canaan, but also 7 of the 19 board members of Career Resources, which sponsors this center, are from New Canaan. One of them is chairman, myself, and Mickey Stamen is the secretary and head of the finance board. So it's a major, it has been, even though thinking about ex-offenders coming into society in Fairfield County has not been a major problem so far. We have a major responsibility, I think, and this is, again, the first of its kind, will serve Fairfield County, which includes New Canaan. So that's Lucy Bainey Center. Second thing is that when you take a look at this study, the 2021 Connecticut Healthy Aging Data Report that Bethany is sending out, I think we should spend some time in September actually going through this report. But the most important thing from a headline basis is that New Canaan is one of the top 6 in the state for having physical activity among seniors. And I think that telehealth is part of the reason for driving that, but also just because we have a healthy oriented group. And then getting sleep. We are among the top 6. There's a whole bunch of like 20, 25 or 30 factors that they look at for indicating a healthy senior environment. And we are in 2 of those, the top 6.
So we sleep a lot down here.
Well, I was going to say, I thought that was an
We get enough
interesting,
sleep. We get enough sleep here.
an interesting thing. And then, so the final thing is that the future of telemedicine, which Jen sent out, and I've been talking to Russ about for some time, is a great opportunity because the state just passed several laws that will be enacted as of today that recognize the reality of telehealth being part of a public health process. So we'll follow up with some conversation over the summer, but my hope is that with the trend lines that are coming, that telehealth is actually going to be built into the woodwork in terms of future of wellness, senior wellness, as well as senior healthcare. So that's it. Thank you.
Thank you, Jim. Our next meeting is September 2nd. We're going to contingent upon the presence of disease in our community, which we hope will be nil. We will move back to the annex building in our Health and Human Services conference room. It is a small room, so we will see what the prevailing winds are, but that's the goal anyway.
Harrison, can you request the boardroom in town hall? Because that room is way too small.
It is. Sure. We can
I
do
couldn't
that.
even sit at the table. I was shoved in the corner.
Yeah. Good idea.
It's not conducive for this size group.
Yeah.
Okay, we will look into that. Should we? Yeah. Unless
Yeah,
there's
I'll
unless
look
there's a
into that.
conflict, it'll happen.
I
If not, we'll go al fresco or we'll.
Yeah,
turn
there was a
it to
conflict.
Zoom.
Yeah, there was a conflict last time. I know that's why we were in this boardroom, but maybe we can get our meeting in there first.
Hi, sorry if I don't think I have great service, so I'm probably cutting you off.
No, go ahead.
I was just wondering, it's Commissioner Alyssa McKenzie. Could we possibly put in that contingency hybrid, just in case some people feel comfortable and some do not? I know that my doctors are not too keen on me being outside my bubble inside.
Yes,
Thank you.
we will attempt to do that. And again, thank you all for attending. May I have a motion to adjourn?
So moved.
Second,
Great.
all those in favor?
Aye.
Aye.
Hey, have a good summer.
Yeah, thank you so much. Have a great summer. We will see you in September.
Thank you.
Thank you.
Bye.
Bye, everybody. I'm going to stop recording. Have a good
Bye.
one.
Thank you. Beth.